If you work in health IT, you probably come across acronyms that keep popping up, and sometimes it feels like you're the only one that doesn't know what they mean. If CEHRT is one of those acronyms, then this video is for you. You may have seen it in RFP requirements, heard it during a vendor demo, or had your compliance team ask about it during a project meeting. Let's go over what it means, and more importantly, why you should care about it in 2025. But before we jump in, if you're new here, I'm Dre from the Dragon Network, an online community where health IT professionals can build their skills, gain confidence, and collaborate with one another on all things related to health IT. I've worked in healthcare for more than 25 years, and I've seen firsthand how understanding standards like CEHRT can make your work more effective, whether you're in a clinical, technical, or project role. CEHRT stands for Certified Electronic Health Record Technology. Now, despite the name, it's not all about EHRs. Any IT system that stores, manages, or exchanges clinical data can be certified. When a system earns CEHRT status, it has been independently tested to meet certain criteria for clinical functionality, so it supports evidence-based care and quality reporting, usability, ensuring it's designed to fit into healthcare workflows instead of working against them, interoperability, meaning it can exchange information with other systems using recognized standards and frameworks, and security and privacy safeguards to protect health data. CEHRT was first introduced in the United States as part of the Meaningful Use program that ran from 2009 to 2017. The program was created to accelerate EHR adoption and make sure that technology supported better care delivery, reliable data exchange, and stronger patient engagement. At the time, organizations had to meet CEHRT requirements to qualify for federal incentive payments. Today, even though meaningful use has ended, CEHRT is still embedded in multiple U.S. programs. Over time, it has moved from being a funding requirement to a baseline expectation for enterprise-ready health IT systems. If you're involved in procurement, implementations, or operational initiatives, certification status is often one of the first things you'll look to assess whether a system can handle the complex healthcare environments and regulatory demands. While meeting CEHRT requirements is specific to U.S. regulations, its influence extends globally. Many major health IT vendors design their products to meet CEHRT standards first, and then they adapt them for other countries. We also see international bodies, like the World Health Organization and the European Union, promoting similar expectations for interoperability and security. This creates a shared technical language across borders, which is becoming increasingly important as healthcare data exchange becomes more global. Whether you're in Canada, Singapore, the UK, or elsewhere, CEHRT has likely shaped the system you're working with. Understanding its criteria can help you evaluate systems more effectively, plan successful implementations, and have more informed conversations with clinicians, vendors, and technical teams. Because it covers interoperability, security, usability, and clinical functionality, there's something in it that applies to almost every single role in health IT. If you want to see the full CEHRT criteria, I'll put a link in the description. You don't need to review it now, but once you're familiar with what's covered, that knowledge can be used in practical ways, such as asking a potential vendor if their system is certified, which version it is certified for, and what capabilities are included, confirming the certified standards and APIs a system supports when you're planning integrations so you know how reliably it can connect to others, or referencing the CEHRT framework during upgrades or changes to check that new features or configuration settings still align with certified capabilities. CEHRT may have started as part of a U.S. initiative, but it has become a global reference point for health-ready IT. For health IT professionals, it's not just about knowing what the acronym stands for. It's about having the insight to make better decisions, ask sharper questions, and understand how your work connects in the bigger picture of safe, effective, and connected care. If you found this helpful, consider subscribing, and I'll see you next time.